Hello everyone, thank you for joining us today in this week's video. Um, we're going to continue to talk about things you need to do to progress in the UK public health specialty training application. Recall in our last video we talked about the two stages before you get to the stage we're going to talk about today. The first stage we mentioned was the application stage, where you just put in your application, and the second stage is the assessment stage, where you do some computer-based tests. If you've not watched those videos, this is a good thing for you to do, to revert back to those videos to feed yourself with the latest information around the application and the assessment stage. Welcome back today, and if you haven't subscribed to our YouTube channel, please kindly do. And I want to thank everyone that have subscribed, and those who have repeatedly watched and given us their comment. We say thank you very much. Today we've got a very great guy with me here. He's my colleague, and we are going to talk you through the selection center. Recall I mentioned that selection center is about the interview stage, but I'm going to defer the stage to him. He's no other person than Dr. Afolabi Kayode, and he's one of our very great registrars in the northwest of England. Can I have you speak, Afolabi?
Thank you very much. So yes, we're going to continue today from where you had earlier stopped with Kalu's sessions, and I'll be telling you about the selection center, everything you need to know, the timelines, the format of the interview, because the selection center is actually an interview, and also how you can prepare, the best way to prepare for the selection center. So as you may recall from previous videos, Kalu must have talked about where you apply on Oriel. So you get your feedback for the assessment center via Oriel. You also get an email telling you if you've been successful or not. This would usually come about 4 to 5 weeks after your assessment center, and then you have about 2 weeks before the actual interview. Again, you book this interview. It's usually done over 2 to 3 days. You're going to have to book this again via Oriel system. And then I think that's it about the timelines. You have the interview process. The format for the interview now, the selection center, is usually, before last year, it used to be, you have two batches of interviews over a total of 60 minutes. And that's going to include time for, say, pre-registration before you get to meet your interviewers. And then in these 2 sessions, you have 3 questions. You're going to be assessed by 3 assessors. Each of these assessors would ask you 1 question, but all 3 of them would be assessing your answers to all 3 questions. And then you immediately go on to the next batch of questions. Again, 3 questions, 3 assessors. But last year, there were some issues around industrial action and not many interviewers available. So they cut it down to 2 questions, 2 questions in 2 sessions. So 4 questions altogether, and 2 assessors for each of these sessions. Again, the timeline was also shortened. Instead of 60 minutes as it used to be before, it was done over about 40 minutes this time around. So just keep that in mind. They might revert back to the previous way, where it was 3 questions in 2 parts, so a total of 6 questions, or they might continue to do it 2 questions in 2 parts. Whichever way it goes, there will be an announcement before the selection center, so you're going to be aware. I'd not mentioned before, the selection center, the interview is completely virtual. So you're going to do it via a system. I can't remember the name now. It's not Teams or Zoom, but it's similar to those platforms, and you have the opportunity to test it before the actual, at least 24 hours before the actual interview. You have an opportunity to test it. Of these questions, whether it's 6 or it's 4, there will be some element of preparation before. So where last year, where it was 4 questions, you had 1 question where they gave you the question about 24 hours before the interview, and you are supposed to prepare and make some notes or jottings, whatever you're going to use to prepare for that answer. All the rest you'll be asked just right there and then. When it was 6 questions, it used to be 2 questions you'd be given ahead, and you'll be allowed to prepare for that again 24 hours before the actual interview. So the interview format, it's like a steeplechase. For those of us from medical backgrounds, you might be familiar with this term. It just means the interview questions just keep going. There's no break. In fact, at the beginning, there's no introductions. You don't introduce yourself. The interviewers don't introduce themselves to you. And the point is, they say that helps each person to have equal time and be able to say as much enough to get the best performance in the interview. So you go right after you've done your registration, where they check your identity and they check your environment to be sure you don't have anybody talking to you, you don't have any pieces of paper or any digital devices that where you might be checking answers from. So they'll do a 360 view of wherever you're taking this interview. You need to keep this in mind as well. So beforehand, prepare wherever you're going to be having this interview, and then you go straight into meet the panel, the first set of interviewers after they've done this identity and environment check, and it is straight to the questions. You're expected to answer the questions. They most likely would not prompt you except if your answers are not what they're expecting to hear. If your answers are not addressing what they're supposed to be assessing, then they'll prompt you in the right direction to answer what they'll be able to assess you against. So what they're assessing against, basically, it's the person specifications. So if at the beginning you would have got to see person specifications even before your application, before assessment center. So at this point, you should be very familiar with what they're looking for. The major parts in this person specification is divided into your personal skills, your public health knowledge, and also your commitment to the specialty of public health. So all of these things you want to showcase in the interview. The questions would mostly be directed towards your answers covering these areas, and I'll talk a bit about each of these areas. But even if the questions do not seem to be directly related to these areas, you have to target and tailor your answers to cover these areas, because those are the things they'll be assessing you against. If you say anything that is not related to the person specifications, it is clearly stated on the advert or the person specification site that those parts would not be scored. They will only score you against the person specification. So you need to digest this beforehand and prepare possible answers to questions. Know how you're going to relate almost every question that would be asked to answer, and to show that you meet those person specifications. So talking about each one of these person specifications, the personal skills, for example, they'll be covering things along the sides of your communication skills, your organization and planning, your time management, team working abilities, and all of these things you need to showcase as you answer each question. How to prepare for this part? There's lots of materials and resources online on how you can improve communication skills. One very important thing is you need to present to yourself. You need to get loads of questions, possible questions that you generate yourself, for public health related questions that would be addressing this person specifications. So answer these questions to yourself, looking at a mirror, see how your communication is. Answer these questions to your family members, your friends, just to improve your communication. Time management as well, especially for the question where you are allowed to prepare before the interview, before the selection center. You're given when they send you the question, they tell you how many minutes you have to answer the question. You need to have practiced that and make sure you're finishing your answer within the allotted time, because you're likely going to lose marks if you do not finish your presentation before the time. And if you finish way before as well, you're likely going to lose marks. So time management, organization and planning as well, this is also going to be showcased when you answer all the questions, but particularly the question or questions where you have the opportunity to prepare ahead, because they will expect you to be able to put your answers into an organized structure. I also talked about team working abilities. You need to make sure your answers are showcasing that you are not just an innovative individual, you are able to work alongside the team, and all these are spelled out in the person specifications. Then public health knowledge, how do you go about improving and getting the best and showcasing that you have good basic foundational public health knowledge? The answer is simple and straightforward. Just keep reading, keep improving your knowledge, because you cannot tell what part of public health the questions are going to come from, and public health is very broad. You're going to have questions from any range, anything related to public health. And so I would say read books, listen to podcasts, read blog posts. Kalu would share some links in the comment section where you can links to different blogs, link to where you can listen to different podcasts. There are different resources available. You can go on your social media platforms and follow public health professionals, public health consultants. Some of these people talk about things they do on a daily basis. Read public health news. These are the places you would get your knowledge, background knowledge, basic knowledge of public health, from which you need to showcase at the selection center. And finally, commitment to public health specialty training. So you need to showcase that your previous background and experiences, how they're related to public health. You need to be able to showcase this with whatever question you are asked, even if it is not directly related to it. The question might not come as, tell us about your previous experience or background, but whatever the question is, you need to be able to tailor it to talk about how your previous experience, your degree, whatever it is that you have done related to public health, you need to be able to showcase that. And you also need to be able to prove that you really want to get into public health and use the knowledge from the training in public health in whatever fields. This is how you show that you're committed to this specialty. Is there any part I've not talked about, Kalu?
Well, I think you've done very well and done justice to the basic things that people need to focus on and concentrate during their preparation. But I was going to ask if you could just, what's your take on maybe if someone had gone through the process of selection center and there's a bit of ranking, so do you have any advice for people about ranking and what you think can boost their chances?
Okay, so it's a bit more difficult to talk about. For the assessment center, I usually say from your preparation, especially if you're using job test prep, where you're able to see how well you're performing compared to other people taking the test. There's nothing like this for the selection center. There's no way you can compare your performance in your preparation with other people. So I think the advice is just get as much knowledge as you can, prepare, practice interviews as much as you can. If you're able to get somebody, public health professional, to ask you random questions and answer on the spot, those would help you prepare for what the interview would be like. I didn't mention earlier, the feedback from the interview, the selection center would also be released about 4 to 5 weeks after the initial, after the selection center. And then one thing I would say, if you don't have any reason why you are particularly attached to any part of the United Kingdom, I mean the region, because it's a national training program, you may be lucky to get placement anywhere in the United Kingdom. At some point during the application process, you are asked to rank different parts of the United Kingdom where you would like to take your training. You rank them in order of preference, from your most preferred to your least preferred. You do not have to rank all regions of the United Kingdom. But my advice is, if you have no strong, cogent reason to be in a particular place in the United Kingdom, rank every single region, because that might be your saving grace, especially if you're not ranked high. If you pass the selection center but you're not ranked high enough to get your most preferred place, if you've ranked as many places or all the places, it boosts and increases your chances of getting into the training program. Though you might have to travel far away from where you currently are, or maybe from where you know people if you're applying from outside the United Kingdom. But again, if you're applying from outside the United Kingdom, I think it's an advantage, because at that point you're not tied to any particular part of the country, and it boosts how many regions you can rank and increases your chances of at least getting one. So yeah, that's the advice for ranking and getting one.
Yeah, thank you very much, Dr. Kayode. And so you've heard it all, and if you've got any question at all, you can pop that on the comment section and we'll be able to respond to that. Before we go, I would like you to like this video, I'd like you to subscribe, and I would like you to share to everyone you think that would need this resource, which is everybody that's trying to apply from any part of the world. Thank you very much. And the last thing is, I've created a bespoke platform to mentor people who are interested in public health and things like that. So you are highly welcome to join. I'll pop that in the description. Okay, bye for now. Thank you.
Bye. Thank you.